First, full disclosure, I am like a very advanced myofascial massage
Mm.
therapist. So I have a
Okay.
very intimate relationship with fascia. So I'm with you.
Mhm.
Fascinating, incredibly important. You know what I mean? A really good
Yeah.
way to think. You can correct fascial imbalances with like passive things, right? Like if you drape somebody in a back bend over yoga ball, right, for 20 minutes, the fascia is going to shift. But in terms of teaching somebody how to change their structure so their fascia ends up in the right place, again, you got to bring it back to muscles. Um, so it's the most important thing is that, and then thinking fascially becomes like a sort of, I hesitate to say this, but it becomes secondary in terms of its practicality.
Mhm.
Um, I mean, there are other ways to think about it. I mean, I know a lot of people do, I've taken stuff with Tom Myers, who's like, the king of fascia, right?
Mhm.
He
Mhm.
invented the concept of the book. He wrote the book with the lines in them. And so anytime you're doing yoga, I mean, yoga's asana is a very fascial experience, right? If you're just like holding
Mhm.
poses, because it sort of gets you in touch with, you know, the pull across your chest and triangle maybe, or whatever, right? And that's all
Right.
fascia. But the fascia, my pushback against that is that the fascia, if you look at a cadaver, which I've done, I don't know, have you done cadaver viewing ever?
No.
If you cut somebody open and really look at the fascia and stare at it for a while, what you see is like these swaths of white, or yellow, usually in a cadaver fascia, and um, then they're wrapped in the muscle. So there's not really a good distinction. So what the
Right.
and I'm just going to put you in this camp for a moment, since you started by saying I only care about fascia. So what the what the fascia loving people, obsessed people are like, it's all fascia, and they're right because it's all connected, right?
Right.
But there's another part of that which is like, look, you're saying that, but really muscles do something a little bit different. They're totally connected, but the muscles are the only thing we can actually fire, right? So in terms of like action steps to get rid of pain, muscles are almost always required.
Okay.
So you have to have a really good sense of how to tell somebody to strengthen and stretch muscles, right? And then in
Yeah.
addition to that, what we talk about is how the fascia sort of shapes you. But I feel like, I guess what's happened, I used to actually be, because I'm a myofascial guy, right? Like that's like, I do hands-on fascial work on people, and I'm really into it. But what you learn if you do that a long time is you can reshape and change pain syndromes, but until somebody resets their muscle structure so that they hold that, they're going to be your client forever.
Mm.
Do you see what I mean?
Okay. Yeah. I see what you mean.
So hence my obsession with strength.
Mm. Okay.
um, but you're not really talking about different things is my point of the wrap, right? You got
Uh huh.
red muscle with white fascia swirling through
Right.
it. So how different is it really? Look, we're in this course to think about being like general yoga
Yeah.
therapy practitioners.
Mm.
So to be balanced, that's why I do talk about fascia, because it's super important. But if you went on the fascial thinking um, all the way, what you do is you'd have people on props for long periods of time reshaping themselves, right? Like that
Right.
would be like one of the conclusions you could come to. And the disservice you would be doing that person, I mean, there would be a great service where you're reshaping their fascia, right? And I, like every yoga asana doing person, I do lots of fascial reshaping, restorative kinds of things, right?
Mhm.
But the disservice you would be doing the person is not teaching them how to keep that fascia where it needs to be, right? Like in a while they're walking around the world.
Okay, and that's strength, right? Is that what you're saying? That's where the
Yeah, well,
muscle
that's,
part
yeah,
comes
that's
in.
muscle
Okay.
balance. That's muscular
Okay.
balance is one way to look at it,
Okay.
which is the
Mhm.
same thing because then the fascia goes where it needs to be. In other words, if the
Ah.
muscles in the back, in your upper back are weak and you're like this all the time, your fascia is now in this shape. And we
Oh,
could say
okay.
one approach would say, we're going to reshape the fascia by doing this. And another thing to say would be like, we're going to stretch these muscles by doing this. It's the same thing. And then
Mhm.
another way to think about it is we're going to do a lot of cobras to strengthen your muscles so that you're like this muscularly and the fascia will follow.